So I wanted to talk about an idea I had about this whole coronavirus thing that is going on worldwide, and something else that we had seen happen historically that, to me, it's an interesting comparison, and I think it's important. So, there was a time when we didn't understand how diseases spread as far as germs went. And people thought that diseases were spread by all sorts of ways that they weren't spread. And diseases were being spread by germs all the time, and people didn't know it, right? And so we had hospitals that were unsanitary and a lot of things that were unsanitary, and germs would be spread and people would get sick and people would die. And then along came some doctors, some scientists that discovered the truth, and germ theory came out, and it's one of the theories of science that has been the most revolutionary. And it changed the world, right? And once it was accepted and doctors and people around the world were on board with it, things started changing as far as sanitary conditions in hospitals and a lot of places. And vaccines were made, and all sorts of advances came after germ theory, right? But there was also a negative thing that happened. There was a time after germ theory where people started saying, well, you don't want to get babies sick either, right? So don't touch the babies. Tell the parents not to touch the babies. Tell the parents to even wear gloves and touch your baby as little as possible. Keep it away from you. Don't let the baby sleep with you. Don't touch the babies. And in orphanages, they weren't touching babies. And a lot of parents were told, don't touch your baby. Only handle your baby when necessary. And now we know that was one of the worst things that can happen to a baby, because it turns out babies need to be touched and babies need to be held. There's attachment. There's all sorts of reasons why babies need to be held. And they found after a while that babies that weren't held, that weren't touched, actually died. And there are all sorts of psychological problems also that babies have when they aren't touched, right? And this is all, common knowledge now. There's not probably any psychologist or any mental health professional or any doctor that would tell you not to touch your baby, or that it's a good idea to leave a baby alone by itself without human contact. But we found out even why babies would die is that loneliness causes the immune system to weaken, right? And we've even found this in old age, right? That people that are lonely and that don't have friends and that don't have strong social connections die earlier. And there's even research that shows that is a greater predictor of how long you're going to live than almost anything, right? So we need each other. We're a social species. We need to be around each other, and we need to be close to each other, and it matters. And so we found that what happened was with the babies, that their immune systems would weaken and they would catch other things and they would die. And that's aside from all the serious, harmful psychological problems that came from that movement. I mean, I know there were books written about it, and there were people who were saying don't touch babies, right? So I just want to rope this into this whole coronavirus thing, right? So now we're being told, social distancing. Don't visit your mom and give her a hug. Don't visit your little nieces, your little nephews. Stay away from your kids. Don't have the kids in school with other kids being kids, doing things outside. Don't touch anyone. Don't go near anyone. And we've been doing this for a while now, right? And they're saying that maybe this is the new normal, that we are going to be, doing Zoom calls for our parents instead of going and actually visiting them and actually giving them a hug and telling them, I love you in person. And I understand wanting to be safe, and I understand taking precautions, and, I've gone along with the guidelines where I'm living. I've taken it seriously, although I'm strongly skeptical about a lot of things. Also, I've done the distancing, I do the hand sanitizer, I do the mask. But this can't be a permanent thing. We can't do this. We can't distance ourselves from everybody else. We need to be connected with other people. The people that you love, you need to see them in person and hug them and tell them that you love them in person. Kids need to play with other kids outside. We need to be in contact with each other. Facebook is not good enough. And to tell people, go home, don't hang out with any of your friends, don't do anything socially, isolate, stay inside. It is a recipe for depression, and it is psychologically harmful. And I believe that in many ways, the harm that is being done by the prescription for coronavirus or COVID-19 is worse than the actual virus. And so I will be taking precautions. I have my mask, I have my hand sanitizer, and, I'm not going to be doing things that are risky, but I will be hugging my mom in person and telling her I love her. I will be seeing my friends in person, the people I care about. I will not be living in a bubble. I think we're making a mistake here, and I just wanted to draw the comparison that we are doing the same thing as a society on a macro level, worldwide even, as we did many, many years ago, and we said, don't touch the babies, too dangerous, there's germs. Well, it turned out that the more dangerous thing was to leave the babies alone and isolate and ignore them, because they died of loneliness. You know what? And we have many, many old people that are in nursing homes lonely, and we're doing the same thing to them. Don't touch them, don't visit them. And that may well kill them. And the coronavirus may never. All right, thank you for listening. Please drop comments here, wherever they are, agree, disagree. I appreciate any feedback, and thank you.